Welcome to Logical Ayurveda. Today we are going to learn the difference between Saptasara Kashaya, Kanashatahwadi Kashaya and Chitraka Grathikadi Kashaya in detail. All these Kashayas are given in secondary amenorrhea and pain during menstrual cycle and gaseous distension of abdomen, Raktaja Gulma as we call it. All these Kashayams are mainly given in polycystic ovarian disease. But what is the specific difference between all these Kashayas, and where is the specific particular unique situation in which you have to prescribe all these three Kashayas that no one will tell you? But before delving deep into these Kashayas, let me teach you a basic concept of Ayurveda. That is Shukram Saumyam, Artavam Agneyam. Shukram Saumyam, if men decide to wear a jeans pant, roam around in summer all day, smoke and drink excessively, definitely their sperm count will take a toll. Similarly, if women, instead of working out daily, they decide to sit in an AC environment all day, eat excess calorie foods, not do exercise, and not sweat at all, definitely they'll have PCOD. Artava is supposed to be Agneya. In all over the evolution, women did so many tasks that are strenuous to the body and would stayed under heat every time. They sweat a lot. But as we advanced, as we are using the brain now, and as we all are doing equal work now, but due to the lack of exercise, this female infertility and PCOD cases are on the rise. Many patients, it so happened that I just asked them to do exercises daily, 10,000 steps daily or Surya Namaskara 13 times. They will conceive without any medicine. People who are having infertility and PCOD, just by doing exercise so much, they'll conceive without having any external support. So it is very important that Artava must be Agneya in order to have a proper fertile susceptibility. So all these Kashayams you see, Saptasaram Kashayam and Kanashatahwadi Kashaya, Chitraka Grathikadi Kashaya, all are Ushna in nature. There is also a type of PCOD which happens due to Kshaya, that is due to anemia, Pandu, Pitta, Anubandha, etc. But most of the PCOD is Kafaja and due to lack of exercise. That is why Acharyas have told Ushna Kashayams like Saptasaram, Kanashatahwadi and Chitraka Grathikadi, etc. So what does Saptasaram contains? Saptasaram contains 7 dravyas, Sapta. Punanava, Vilva, Kulatta, Erenda, Sahachara, Shunti, Agnimanta. All are Ushna in nature, all are Ruksha in nature. Most of them are having Katu Vipaka except 2 drugs. Punanava, which is having Shita Virya, and Erenda, which is having Madhura Vipaka. So the Anupana that is told is Guda, Kana, Patu, Hingu Vacha. Gula means Guda, Jaggery, Kana, Pipali Churnam, Patu is Saindavalavanam, Hingu Vacha can be used as a Hanupanam. In constipation, you use Saptasaram Kashayam along with Guda or Jaggery. In Agnimandyam, you use Saptasaram Kashayam with Pipali Churnam. In Ruchimandyam, you use Saptasaram Kashayam with Saindavalavanam. In every Yoni Shula, Hrit Shula, Kukshi Shula, Prishta Shula, Shoni Desheshu Shula, all Shulas around the Nabi, including the uterine pain or including the back pain that comes during menstrual cycle, you use Saptasaram with Hingu and Vacha. Easy thing to use along with it is give Hingu Vacha the tablet 2 BD along with Saptasaram Kashayam is an easy thing that we can do. So coming to Kanashatahwadi Kashayam contains 10 dravyas. It is Kana, Shatava, Karanja, Chirubilva, Devadaru, Barangi, Kulatta, Tila, Hingu and Lashuna. Shatava, Shushruta describes Shatava, which is the main content of Kanashatahwadi Kashayam, is Rudira Gulmajit. It is very useful in curing the difficult Raktaja Gulmas. And it is specifically indicated in Yoni Roga. This Kanashatahwadi Kashayam helps in hypothalamo pituitary ovarian axis regulation, and it helps in having proper menstrual cycle every month. See, most of the dravyas here like Hingu, Kulatta and Lashuna or Medohara, they are fat burning and hypocholesteremic in nature. And this Kanashatahwadi is specifically indicated in Alpartava and Nashtartava, where the patient does not have menses every time, etc. And there are some dravyas which are anti-diabetic as well. There are some dravyas like Karanja, Devadara, which are anti-diabetic, anti-inflammatory, fat burning, metabolism increasing. or all the dravyas here in Kanashatahwadi are Ushna. Most of the dravyas in Kanashatahwadi are having Katu Vipaka. Kanashatahwadi is the Ushna Kashaya with no mercy at all. At least Saptasaram has Punanavan Yeranda, Kanashatahwadi has nothing. So Kanashatahwadi is the ultimate Ushna, fat burning, cholesterol reducing Kashaya. So you can use it accordingly. You better not choose it in a Pitta Prakriti patient. Chitraka Grathikadi Kashaya. Chitraka Grathikadi Kashayam contains Chitraka, Granthika, that means Pipali, Eranda and Shunti. At least Chitraka Grathikadi Kashaya contains Eranda, which is Madhura Vipaka, and somewhat coolant, one coolant dravya. And Saptasaram Kashayam contains two coolant dravyas. Kanashatahwadi contains no coolant dravyas, nothing for Pitta. That is why Saptasaram can be less Ushna than Chitraka Grathikadi and Kanashatahwadi. Kanashatahwadi is more Ushna than Chitraka Grathikadi and Saptasaram. That is why you can give Saptasaram for long term. Because when you give a long term, patient won't get urinary tract infection or Ushna because there is Punanava in it. And what is the difference between these three Kashayas? Everything contains Ushna Dravya, Luksha Dravya, Medora Dravya, etc. Difference is Saptasaram is Shulahara Visheshatvam. Whenever you have patient with PCOD, with low backache, with pain during menstrual cycle, pain as the severe symptom or Vata as a severe symptom, you want to do Vatanulomana, and whenever you want to choose a prescription given to the patient has to take for 6 months or 1 year, then you can choose Saptasaram because it contains neutralizing dravyas, unlike Kanashatahwadi and Chitraka Grathikadi. So Saptasaram is Shula Visheshatvam. And Kanashatahwadi is Nashtartava Raktagulma Visheshatvam. Whenever you want the patient to have proper menstrual cycle with good flow of menses, then you must choose Kanashatahwadi. The patient is obese, patient is not following exercise properly, patient is having insulin resistance, patient is having a lot of cholesterol, then you choose Kanashatahwadi because Kanashatahwadi is no mercy Ushna Kashayam that can scrap the fat out of the body. When it comes to Chitraka Grathikadi, as the name itself tells, when you want to reduce the volume of the ovary, the earlier scan report, ovary was 4.5 into 3 into 2. Now the scan report is 2.5 into 2. You want to reduce the volume of the cyst or volume of the ovary, then you can choose Chitraka Grathikadi because Granthika refers to Pipali also, and I have seen people use Chitraka Grathikadi for other abscess and lipomas and other structural things as well. I don't know how long that is effective, but any kind of structural growth, you want to reduce the volume of the ovary, there you can use Chitraka Grathikadi. So Saptasaram is Shulahara Visheshatvam, Kanashatahwadi is Nashtartava or Alpartava Visheshatvam, and Chitraka Grathikadi is Grantihara Visheshatvam. So take this deeply into the mind. In fact, there was a study done on the difference between Saptasaram Kashayam and Kanashatahwadi Kashayam. And in that study, they found they've chosen various metrics to study. They have given the patient with Saptasaram Kashayam with Guda in a certain population, and Kanashatahwadi with the fried hingu, Gritabarjita hingu in certain population, and they have recorded it. They have recorded number of parameters like interval between the cycles and duration of bleeding, pain intensity, BMI, hirsutism, acanthosis nigrans, and volume of the ovary, etc. And what they found is Saptasaram Kashayam is helpful wherever there is uterine pain involved. Wherever there is pain during menstrual cycle involved, it has better outcome. In fact, it increases it is much more helpful where you need endometrial thicknesses. And Saptasaram has this fibrinolytic properties. Fibrinolytic properties means it can dissolve the clots and it can reduce the intensity of the pain during the menstrual cycle. Whereas in Kanashatahwadi, they found out that cycles become regular and the volume of the menstrual blood flow is proper when using Kanashatahwadi along with the Grita Barjita Hingu. So you can use it accordingly. So I know some of the doctors who mix all these three and use it together. It always depends on you what to use and what not to use. But whenever there is a lot of days involved, whenever there is a prescription goes above 3 months, I will definitely ask you to prescribe Saptasaram because it contains some neutralizing agent as well.